Hey everyone, welcome to our August Ethos webinar. This is the Culture Shift method, and I am Austin Townend, growth marketing strategist at Ethos Benefits. Today, I'm excited. I'm really excited about today's webinar. And I think that would be an understatement because today we're getting into wellness and how we can make it an actual leadership and culture strategy. So you're going to walk away with a three-pillar framework, the assessments that measure burnout and trust before they show up in a claims report, and the case for ROI you can bring straight to your next leadership meeting. So today's webinar does also go to your HR, CI, and SHRM credits, so those activity codes will be added to the chat at the end of the webinar for you to apply. So without further ado, I'm going to pass it off to Chelsea.
Hi, everyone. My name is Chelsea Rikus. I'm the president of Ethos Benefits. I see a lot of our clients and a lot of our friends here as attendees. But for those of you that I don't know, a quick background on Ethos. We're one of the nation's first fee-based advising firms, putting fiduciary duty above all else. Obviously, working on health and welfare programs and working alongside mid and large market employers nationwide and really flipping the healthcare sucks paradigm and this reactive renewal process year by year on its head, and really working to create multi-year plans that not only deliver better health outcomes, but better financial outcomes for plan sponsors like yourself. I'm, like Austin, very excited about today, and I need to be incredibly transparent why. And the reason is in my 10 plus years in the benefits industry, I have never wanted to do a wellness discussion. I have never endorsed a wellness initiative. And I'm just, again, I'm going to be incredibly transparent. That's how we do it over here at Ethos, if you know us. And the reason is I find a lot of the times they really lack. It's either like a checkbox initiative of well, yes, we have a wellness program. We do a step counting thing, right? Or the CEO likes Pelotons. I've heard Dr. Romie say that. So now everybody gets a Peloton membership versus being something that's very data driven and actually delivering ROI. I took a certification maybe 3 years ago on wellness initiatives and wellness strategies for financial wellness, blah, blah, blah. And they literally said in this certification, there is no way to measure return on investment when it comes to wellness. However, you can measure return on engagement. While I believe that's valuable, right? Return on engagement, that is a worthy thing to measure. I've just always wanted to see ROI, right? Like if we're going to invest in something, can it be number one, something that people actually need, want, value? And number two, can it support the overall initiative of the company? And it wasn't until I met Dr. Romie that I understood that those two things can be true. And I've vetted quite literally hundreds of solutions. So when I say that I'm excited and I'm behind this, I couldn't mean it more. I'm actually surprised that we're here, to be perfectly honest, but we are, and I can't wait to share what I've learned from Dr. Romie with all of you. So before we get into Dr. Romie, who, by the way, is a board certified physician, she's the chief wellness officer for Great Wolf Resorts, which has over 14,000 employees. She's been a career-long researcher of brain health and performance in the workplace, highly sought after keynote speaker. That's another reason we're very lucky to have her today. She works with a handful of Fortune 500 companies and global organizations featured in top international media, including Financial Times, NBC, Forbes, NPR, on USA Today, best-selling author of The Busy Brain Cure. And my favorite thing about her is how mission-driven she is, which you're going to see today, and how much that aligns with ethos and us as humans. So before we turn it over to Dr. Romie, though, we do have another special guest who will be adding a lot of good insights from the plan sponsor side. And that's Maria Fraga, who just recently joined Ethos Benefits. And I would probably do an injustice to her background. So I'm going to turn it over to Maria to tell you all about her experience sitting on the plan sponsor side as well as in the advising side.
Yeah, thanks, Chelsea, for that warm welcome. So, Maria Fraga, as Chelsea said, I sat on the employer side for over 20 years as the plan sponsor. And well-being was one of the things everybody talked about. And as Chelsea said, it was a check the box. It's, do you offer apples in the room? And, great, but how do you measure it? That was always the challenge. And then when we begin to hear, well, there really isn't a measurement. There's no ROI. There's a measurement on engagement. There's VOI for a while was sort of that new term. I just chose not to accept that. And I chose to really take a hard look at what really is driving that in the culture and making proposals to make some pretty significant investments in well-being, but then also being able to measure them. I am also have the honor of presenting with Dr. Romie a couple of times now, and I'm thrilled to be here to talk about this again today, which I believe is a truly very important discussion to have.
Thank you, Maria. Well, Dr. Romie, why don't you take it away?
Hello, everyone. I don't take your time, whether it is morning, lunchtime, or afternoon, or in the evening, for granted. And I tell you, it is so important for me to be here personally, because as a board certified brain doctor, the truth is, I wasn't meant to survive. Back in 2010, I was like all of you on this call, especially my HR colleagues. I just have a special auntie worry about all of you on the benefits HR side of everything that you're holding today. Back in 2010, from the outside, it looked like I had it all pulled together. I was not only a practicing physician in neurology, a full-time professor at a medical college, and doing cutting edge research on the roles of women's hormones in the brain. And like every single one of us on this call, high achieving professional, I was pushing myself to the edge. And chronic stress leads to disease. Chronic stress can kill you. And it nearly killed me. And I should know better. I'm a brain doctor. 2010, I ended up in life-saving surgery. And the worst part wasn't waking up in the surgical ICU, waiting to see what the cardiothoracic surgeon was going to say to me. The hardest part was that I knew that sinking feeling of what it feels like when hope departs your soul. And even more haunting, the only memory I have of that time, other than the severe chest pain, was that nobody at work asked me if I was okay. And so today, as Great Wolf Resort's Chief Wellness Officer and the CEO and founder of the BrainShift Institute, my mission is this, that I want to help use brain science so that no employee ever feels alone again at work. That is why we're really here. And I can't think of a more aligned partner than the team at Ethos. My relationship, as you heard with Maria, goes back to both of our previous roles. And we were both that cutting edge leader trying to create change in large systems and found each other. And to have found Ethos in the process, where they use that same conscious leadership model to say, how can we really ensure that every employee feels seen, heard, and not alone at work, whether you are an organization of 5 or 50,000. I have spent now the last 10 years studying and executing at the ground level how we can make this work. And that's why I'm here today. I am running slides here in the corporate offices of Great Wolf Resorts in Chicago. Maria is my wonderful co-hostess. At any time, if you have a comment, a thought, you are in webinar mode, please type it in the chat and Maria is going to engage here with me. As I mentioned to you, not everything that I do is based on a thought or a feeling, and certainly not the latest wellness trends. Having done workplace wellness now for over a decade, we've gone from smoothie recipes to meditation apps to Pelotons to benefits costs that are skyrocketing out of control that model how unhealthy we are in North America and the toll stress is taking, because I know we have folks here like us at Great Wolf that have global teams. And so I am here to actually break down in simple terms. Let's use brain science so we can protect your brain at work and your people in this rapidly changing world of AI. So it starts here. How many of you are here today? Because at the core, you're like, no matter what we do for our employees, no matter how we stack our benefits, no matter what engagement activities we have, our employees are distracted by personal problems, still stressed out, and saying, does work-life balance even exist? And maybe you've even noticed they've become cynical, disengaged, they're just showing up for the paycheck. And the number one thing is, oh my God, if one more thing changes. Is that something? Type yes in the chat if that is your team or the clients that you are serving. And I'll ask Maria, is there anything else you all typically hear at Ethos as well?
Well, sorry, Maria, I'd have something really quick. AI, there's so much resistance, not inside the Ethos organization, thank goodness. But I'm hearing that a lot from
Yes.
clients that employees are
Mhm.
incredibly overwhelmed by
Yeah,
changing AI. Like we're doing this today, but tomorrow it changes. And
it
Maria,
is.
go ahead and add your insights as
Yeah, no, I was going to say again, that same line of AI, it's also a fear, right? And the stress that the fear causes of AI now being part of the everyday everyday work that everybody does.
Yes,
And people begin to wonder, what does that mean for me? Unnecessarily, right? So
mhm.
I think AI is a really big one, Chelsea. I agree.
It is. Thank you both for sharing that. And please, if anything else is there in the chat, please continue to share. I can't see the chat with my slides running at the same time, but Maria is here and we want you to be a part of this conversation. That is not this talk today. My other keynote is Protect Your Brain in the Age of AI, and the Future of Work. That is something that I am actively researching after having researched stress and burnout in the workplace, and likely the subject matter of my next book. Stay tuned and ask me questions at the end. Bottom line, we're still learning the effect it has. But if I take the crux of what Chelsea and Maria are saying, the fear, the change, there is a psychological term for this. We are all feeling it. Forget work. You turn on the news cycle and whatever AI bubble you live in, it's not really good. It could be your family. Change is feeling exhausting and hard. And people often use the term, I'm burned out, I have no work-life balance. And what exactly is happening is at the bottom of the slide, it's called change fatigue. Now, for those clinical folks that may be on the call and watching this webinar, in my world, that's a pop psychology term, but it really is this starting of anxiousness and difficulty focusing because of the overpromise of productivity with AI, and our brains are not meant to multitask. And it can lead then to feeling mentally exhausted. And yet another new process or priority gets there. So you say, I'm in a brain fog and disturbed sleep. So I'm here today for this reason that wellness is a leadership strategy. We are failing our people. They will continue to feel unseen, unheard, complain, and feel alone if we just say wellness is just something to slide into the benefit stack, that we need this benefit. How can we pay for it? And people just see this as something they opt out of until there's a crisis. They're in financial crisis and then they come to HR and they want to know, what can I do for financial planning or getting help to buy my first home? This goes on over and over. The way that I have seen this succeed across two large organizations as a chief wellness officer and talking to about a couple of hundred other CWOs that serve national and the US and global organizations is that wellness is actually a key pillar in leadership and culture. And that is your takeaway message here. I am going to give you the proven framework that I do as a consultant and keynote speakers and speaking to your boards and your C-suite executives. When we place wellness into leadership and culture, this will affect how people show up, stay, and perform. And that is the key. We have to remove it out of the benefits world. However, see those benefits as tools that we can use, and we'll talk about that. So, how do we go about this? Everything that I do is both quantitative and qualitative data, because the danger, as Chelsea alluded with wellness, dating back a decade, is you have a CEO who, Chelsea used this in our podcast interview, who liked jump ropes, meditation apps, a Peloton, and they say, well, that needs to be our wellness program. There's an inherent bias. Or the benefits person has gone out and heard from 3 or 4 employees, are you going to cover GLP-1s? What about fertility treatments? But what happens to the other thousands of employees? How do they feel? So we developed frameworks that have been proven in organizational psychology to work. The first one is my IP that we add in there, and you're going to take it as well. It's 3 pillars. Are you protecting your brain in this age of AI and rapid change and transformation? Number 2, are you protecting your people? And number 3, how do you protect your business? And we're going to talk about these 3 quickly indexes that we come in and partner with Ethos and can do for your organization. If you look at the emojis on the right side, anytime I'm sitting with a CEO, I'm sitting in an executive leadership retreat like yours for your companies or with your board, they're worried about bottom lines. You have to answer to the shareholders, right? But my answer repeatedly through the organizational data and what we've seen here ourselves is, in times when companies are struggling and resources are being put towards AI, those companies that are still succeeding and meeting their profit margins don't put business and revenue first. They actually put their people and their own brains first. And if you can do that culture shift, that key takeaway, am I protecting my brain? Am I protecting my people? The revenue, client outcomes, products sold will come. So let's start. What do I mean by protecting your brain? There is fear, the rapid multitasking. Even since I did my research for the Busy Brain Cure book, what has happened is multi-digital device use has multiplied. On top of it, using AI as I put in air quotes, productivity tool. Has anybody found that all the options AI gives us is actually hindering productivity? Or maybe your to-do list, like mine, quadrupled because we have Claude integrated into our systems here at Great Wolf. Is anybody else finding that? Like, well, ChatGPT was great at first because it was helping me plan that trip to Italy. Now that Chelsea is saying that, or it'll give me a quick list of, I just moved to Chicago last year. It'll give me a great list of all the places to eat Middle Eastern or gluten-free restaurants, but it's now kind of clogging me up in my business. Is anybody else feeling that way? Maria, are we getting any feedback here in the chat? Not yet? Okay.
No, not yet.
Okay. So basically, that's what we mean by protecting your brain. And what we do is give this busy brain test to you as an individual. You're going to take it in a second to see, am I suffering from change fatigue or burnout? But then what also happens is, when I came and was introduced here at Great Wolf, we had 600 of our leaders from all 23 lodges and corporate in a room at a leadership conference. 600 people took the Busy Brain test. I had organizational data on actual health of our employees. So now, the benefits team was hearing, well, are you going to do something about GLP-1s or fertility benefits or whatever the latest sexy benefit out there is? But I actually had organizational data of how well was this cohort of our leaders doing, and we did it separately for our frontline employees too, in cognitive measures like brain fog and sleep and productivity, mental health, mood, physical health and symptoms, and your sense of purpose and meaning at work. And that was the real data, right? So if you're online, I'm going to just put this QR code here in front of you. You can take your phone and scan it. You're going to come to what we call the busy brain test. I want to know, are you suffering from change fatigue of everything that's on your plate? And by the way, while you take this, please know we are no longer collecting data. This is a HIPAA compliant server. The research is done in 17,000 brains. The research and the book have been published. You will have an option, though, to put in your email. And when you do the 8-step, 8-week protocol, that will help combat change fatigue, busy brain, and heal burnout, including the lap slips, all of it is sent in an email to you. So that is just our personal experience while I'm data collecting, is creating a wellness experience for employees. And by the way, please know, I am still invited to come and put this in a part of my keynote addresses. And we're still seeing, sadly, the data hasn't improved since that post-pandemic time. We're still seeing more than 80% of people in organizations have change fatigue or burnout, which is a score above 40. So that's what this is. So I just wanted you to experience this test if you're interested. I am Dr. Romie on Instagram, on LinkedIn. Reach out to your Ethos partner. They will put you in touch with me. If you're like, oh my God, Dr. Romie, my busy brain score was a 77. What do I do next? I am here. Colleagues, I know both our Ethos clients as well as many colleagues in the HR world that join this or will be watching the recording. I'm here for you. I care. So please do that. I just wanted for you to see how easy and beneficial this one exercise could be. And really, bottom line, what is it? If you're here in the United States, you know you can't buy a new car or get a home loan, car insurance without getting a credit score. How is it that we're not walking around knowing what our brain score is so we can protect our brain? And that's really at an individual level, but it gives us this. So then when I get that organizational data and I saw that 600 people had these symptoms, we come back to this traditional whole person wellness model. There are 8 circles here. Your organization may have something like this. What I found was a lot of the top consulting firm use this whole person wellness model. The Wellness Alliance used it, McKinsey, and that. And I want to give credit where credit is due. Another powerful female researcher, Dr. Swarbrick here in the left corner. She is a PhD researcher, at that time was at UPenn, who coined this entire model. And it was actually first used in addiction recovery. It's not just a mental health issue. There are always a element for us to heal. I knew that when I was burned out and sick, financial, social, spiritual, which is really your sense of purpose and meaning, occupational, what's going on at your job. So that when an employee comes out and says, it's my job that's robbing me, well, I'm always curious, what are the other 7 areas doing? So this is how we start to build it. But guess what? It becomes really generic. Because what happened was when I saw all the best workplaces to work for mental health or certified wellness, it looked like everybody's wellness triangle, square, or circle looked the same. They had 6 to 8 of these. And then that's exactly going back to what Chelsea was saying. Wellness doesn't work because we created something generic. And that's what I learned as a chief wellness officer. You had to protect your people and your business, and you had to personalize the program. Prior to Great Wolf, I was at Evolution Hospitality. I first in 2015 started to help shift their wellness initiatives. In 2018, I was one of the first named chief wellness officers in the country. There was no GPT, even Google. I was like, oh my God, what does a chief wellness officer do? And there was no help. I reached out to a few colleagues in LinkedIn that had similar titles, director of well-being, and there was no roadmap. So we had to create our own roadmap. And I did that with the quantitative analysis, but I had embedded with these employees that managed hotels. They were a company of about, at their peak prior to the pandemic, 7,500 employees. And we learned, what did the people need? And we created a custom whole person wellness program that was called the Power of Pause. And it brought mindfulness in to our operations of hotels 24/7 and also into our personal health and social relationships. To this day, that program is still existing, even though the CEO has left and sold the company and we were acquired by Aimbridge, and I'm no longer with them. We had a 72% engagement. Hear that again, because Maria and Chelsea will tell you most of the benefits that you bring in, you're lucky to hit 3 to 5%. Am I right, Maria or Chelsea? Or is there any wellness benefit that you bring in that sometimes has more engagement?
The only thing go ahead, Maria.
I was going to say, my experience is actually even lower than that.
Oh, okay.
Right. And if you think about going back to that check the box, right? People even stop measuring. Yep, we offer it. That's it.
That's it. It's on the website for new hires. Yeah,
Yeah.
exactly. We would measure and 72% engagement. You could walk into any hotel and on breaks, see the power of pause, meditation hour happening, the mindfulness breaks in 13 different languages. Guests would start joining. And then what would happen on the NPS or Google reviews or TripAdvisor? They would be like, this is the coolest hotel ever. It's a Hilton, but we joined the restaurant staff and meditating, and it set the whole day up for success. What a cool company. Can you imagine if that was out in Google reviews or TripAdvisor about your company? And how did we do that in protecting our people? So when the pandemic happened, I think this is one of the most heartbreaking moments of my entire career. Maybe some of you had to go through this as well. We had to close hotels down. We had to furlough our employees. We went from 7,500 employees to maybe less than 900, the bare minimum to keep hotels open and few corporate staff. And even I stepped away temporarily. And then in certain parts of the country, the world came roaring open and everybody was opening hotels, and you had to do something called a callback. Well, we were now a part of a greater, the largest hospitality management company in the world, Aimbridge. And Aimbridge couldn't figure out, what are those evolution hotels, independent lifestyle, doing different than us? Their callback rate, when we call an employee and say, hey, how are you? Are you on unemployment or working at Costco in the grocery store? We need you back in the hotel. We had a 12-time higher return rate of coming back to work than the Aimbridge hotels. So they went out and surveyed the people, and what did the people say? Well, they cared about me. We had power of pause. We had a chief wellness officer. She was our homie, Dr. Romie. If I ended up in the emergency room, I could just like text her and she would, work with us. My company cared for me, and that's what it means to protect your people. Empathy is actually a key leadership skill to protect the brain and protect your team. We have an actual caring and empathy assessment that we measure when we are on the ground, and it's what I did here at Great Wolf. We then embedded it into our employee engagement surveys. We use Medallia. Some of you may use Gallup. Some of you may be scratching your head going, I don't know. I just kind of walk into the cafeteria and ask everybody how they're feeling. That's how we measure engagement. There's no wrong way to do this. And what did we find? We have one of the highest turnover rates. So Great Wolf, we're a large indoor water park company with hotel and restaurant operations. We have one of the highest turnover rates in the entire industry. I don't know if any of you all are in hospitality, restaurants, hotels, travel. And we improved that by doing one key thing. We got the busy brain test scores of the leaders and gave them a customized program. And then we got the data from our employees and we embedded empathetic listening, and started with our supervisors and managers and all the way up. And we could measure it in both of our NPS scores and ENPS using Medallia. And we've actually exceeded the benchmark that Medallia reached back out to us and said, what are you guys doing differently? Because you're way above and out of the range of where the rest of the industry is, because we chose to protect our people. And so what does that mean? When a competitor opens up across the street and they're offering $1, $2 more an hour, which is significant if you're a frontline employee, employees may go, but they come right back going, no, they care for me here at Great Wolf, or I'm not going to leave. I feel like I have purpose. And what's one thing I would give you just as a tool for those of you that are here live or watching the recording? We literally have trained our supervisors and our managers and directors when they're overwhelmed and people come with their personal problems or say, I have no work-life balance, to say this one sentence: breathe, look someone in the eye, put your phone or computer down and say, I'm here and I care for you. So just if you're sitting there, I know you may be doing emails or eating your breakfast or lunch, could you just pause and say this out loud with me? I'm here and I care for you. And I'm going to model that. Austin, Chelsea, Maria, I'm here for you and I care for you and the entire Ethos team and what you're doing. I just think of the entire time I was working as a physician before I got sick. I don't know that any colleagues exhibited that care. My patients did. My parents, my friends, who I was isolated from working long hours. This one phrase has the power to transform culture. So, the last part. Has anybody opened up LinkedIn, Instagram, Facebook? What are the other, Twitter, X today? TikTok, TokTik is on. I say I've turned into the auntie I make fun of. Anybody out there? Chances are you didn't get a real post. 90% of the posts are now AI generated. That myself, Chelsea, Maria, Austin, because I see their faces, used AI to make us sound a little smarter, and you're not seeing the bad grammar that you would have if I wrote the post myself, right? We're losing trust. We've lost trust in education, in the media, and most of all, people say Congress has the worst approval rating. No, the highest disapproval rating is of our workforces and HR and our leadership. If you have Gen X, Gen Alpha in your workplace, like we do at Great Wolf, they happily show me all the TikToks of the anti-corporate speak. And they can't believe they are somewhere where we care about building trust. So how do we protect business? Business meaning serving our guests, serving your customers. There's a trust index, and it starts with your employees or your people. And a trust index measures the ability. If I hire Dr. Romie, does she have the ability and capability and ethos to do what they say they're going to do? The benevolence. Do they really care about me? Are we going to try to make it a win-win situation, or is it all about Dr. Romie and ethos making a profit? We've all interacted with those companies before, haven't we? And it breaks our trust. And then integrity. Do we show up with the values that we say we have? Trust is not a soft skill or a gut feeling or intuition or a meditation state. Trust is actually a brain state and something you can train your people and your organization. And the ABI Trust Index measures, do your team members trust their manager or leader? So anytime when we had an engagement survey and we just saw that there was an outlier in one of our key areas like housekeeping, food and beverage, guest services, aquatics team, that they were really low or really high, I go in and measure and use the trust index to really figure out what's going on. Because if you just sit down one human to human, go, y'all had the lowest engagement survey scores, what's going on? People may not trust you, or they're just going to gossip, or you get a one-sided thing. This actually gives you data. And we actually can see that if you want to improve your net promoter score, that is how your clients perceive you, that it all has to do with trust. It goes back to someone reading on TripAdvisor, wow, I mean, this is a Hilton, but I went in and this team was meditating and they told us they have a chief wellness officer. How cool is that company? And yeah, it was like the whole vibe. Everywhere we went, the hotel employees were happy. I would stay here again. Wow, what a positive NPS and ENPS. So those are the three things we measure. And then we say, what benefits do you need? So at Great Wolf, the average age of our employee, 14,000, over 14,000 employees is 19 years old. We have Gen Z and Gen Alpha employed because these are our lifeguards. This is us doing what our custom program is called Be Pack Positive. It brings positive psychology in to say no matter what's going on at work or in the world around you, you can come into this environment, into the pack, our team, and feel positive and feel cared for. And we've actually started to do this exercise that you're seeing modeled here with our aquatics team members, that when there is a crisis at work, a holiday, somebody's birthday or team building, we put people in the circle of trust and do this exercise. And if I get to come and meet you all in person somewhere, the Ethos team or all of you as clients, we actually do this in my keynotes and workshop, and you learn how to bring the circle of trust to your employees. So we end this and I open this up to conversation with all of you on the call and with my colleagues at Ethos is this is what it means to build a benefit stack. So as we looked, What were the things that were going to build trust between corporate and all of our employees? Can imagine the average age of 19. Anybody have a guess? Put it in the chat. What were the two benefits that moved the marker for us? In addition to doing the empathy and leadership training development for our leaders, anybody want to guess what the two things were that we added in?
So we have pet insurance,
Oh, I love that pet insurance.
That was me.
Yes.
PTO,
Mm.
legal insurance.
Mhm. Average age of employee, those are all great, but no, 19, we needed to shore up our mental health benefits and counseling. They were really relieved to have a brain doctor on the floor. We have 5 or even 6 generations in our workforce here at Great Wolf, and I can go and have a very intelligent clinical conversation with Gen Z and Gen Alpha about different therapy modalities for anxiety and neurodiversity. And some of our other generations of leaders are like, what's Dr. Romie talking about? Doesn't that belong in the doctor's office? So we had the opportunity to shore up that, and gym benefits, gym
Mm.
memberships. Our pack wanted that. And so we've partnered nationwide with Planet Fitness and Lifetime and their subsidiaries to give a deep discount. And that was how we were like, wow, I go to work and somebody cares for me and they listened, and we have this massive discount for my family and I. And even if we leave Great Wolf, we can keep that discount and go to the gym, and they stay for the mental health benefits. And we're constantly looking how to improve that. Now, in your organization, don't take down the notes, gym and mental health benefits, because nobody may
That's
want that. That's just like shoving a Peloton down someone's throat. But after doing our qualitative and quantitative data, we knew that was coming up over and over and over again. And that ROI could be measured. So how do we measure ROI at the end? I'm going to give you 3 things that our CEO will tell our board of directors, and we're private equity owned. Having a chief wellness officer saved the life of 3 of our out of our 23 general managers. To reach the pinnacle of being a general manager of a resort of one of our sizes is about 20 to 25 years in the making. And anybody in hospitality will tell you our pipeline got robbed in the pandemic. It is really hard to find leaders that understand that operational acumen to operate that. So that alone, the cost of replacing a high level leader by having wellness and care, that was number 1. Number 2, identifying and making sure 5 to 6 generations in the workplace felt comfortable to have conversations about mental health was number 2. What is how we measured our ROI. And number 3, we saw it in our engagement surveys, and that we're actually measuring retention now and seeing in those lodges where we have put in all of these systems and things into place, are we able to improve retention? And that's how we're measuring it, all customized. And that's what I come in and do with the Ethos folks. And so that is it. I will stop sharing the screen unless someone wants to see a slide, and I'm going to hand it back over to you, Maria and Chelsea and Austin. And I would love to know, what thoughts are there out there in the audience and questions.
We
So we
do
do
have
have
some
a
questions. Before you go, Maria, I just had Dr. Romie, you had told me something, and maybe it was in person or on our podcast. I just want you to share it with the folks on the webinar today. You talked about like you literally went to locations and sat down yourself and had conversations that then led you to understanding what wellness initiative made sense for your population. Can you talk through like what those conversations look like? And if the plan
Yeah.
sponsors on the call today want to do something similar, like what should they be asking to get to the crux of what they
It
need?
is. What I will tell you, and this is going to sound counterintuitive, do not go in with a poll or a survey, or you've just broken the ABI index. Because the number one thing that breaks the trust is when a leader or outside consultant comes in and says, I have a poll and a survey for you to take, unless you get real-time results. So when people take the busy brain test, they're getting real-time results. They're also being honestly told, we're going to de-identify your data. So I won't know Maria or Austin or Chelsea's score, but we're going to get the aggregate of all 600 of you and look and see where's their area of improvement. And then we go and report back. So Chelsea, what we did was, and when I go in with other clients, when I went into Great Wolf in the first 3 months, I probably ruffled a lot of feathers with my blunt attitude, but I saved us $500,000 in my first 3 months here because I went to several of our lodges. I did listening sessions, and we had employees at every level, frontline, mid-level manager, and director level from every department. We have several here in hospitality. And they got to sit in and have a candid conversation while I was a good auntie and I fed them some snacks and hydration. And they got a break from work. Somebody from HR was just sitting in the corner quietly taking notes. And I asked them, what keeps you happy and healthy here at work? What can we do better? And the number one thing that kept coming up was, well, I was complaining to you all, and you gave us this stupid app. And it's worse than Instagram. You just open it, and anytime I have a problem, they're like, well, we have this app here at Great Wolf, and we were paying $500,000 a year for this app for them to open up and just be reminded to hydrate. And every one of our employees was like, I get better advice than that on Instagram and TikTok. And I went back to corporate and ruffled a few feathers because, I don't know how many people had pushed to get that in. We were able to cut that loss and build this customized program so that now people saw, yeah, we heard Dr. Romie went to 4 lodges, and all of a sudden, immediately, they got rid of the app. They're building something. She's working on the gym and the mental health benefits. And like there were operational things like putting the right type of cushion paddings on the ground for guest services when they're standing behind the front desk for 8-hour shifts. Like they saw immediate action. So it's open-ended question. What keeps you happy and healthy at work? What's not working here? We got a lot of operational information that I passed on to the operational teams, and then feedback immediately of I heard you, not in a corporate town hall, but back in the lodges to say, this is what we're doing.
I think that's the key that I've noticed whenever, whether it's wellness or any benefit satisfaction type initiative, when you're trying to gauge your population, you can only ask if you're ready to make a change and actually ready to listen to the feedback, because that's probably, I've seen a lot of organizations that will ask what other benefits would you like? And then they see something, and not to say that you can add every single one, but are you asking to make yourself feel better, or are you asking to actually make organizational change, right?
We had a lot of requests as I've been out in the field, and I'm sure many of you are hearing GLP-1 and fertility benefits. And we were able to say, hey, we're in economically challenged times, like the entire hotel industry. And that's a benefit that we just can't afford. Dr. Romie and the HR team are working on alternatives, but that is just not something. So even if you can't make the change, if you say, I heard you, and this is the reason,
This is the
and you
plan. Yeah.
and you put it in TikTok speak, put it in TikTok speak, not benefit speak, TikTok
Mhm.
speak. Wow, they cared. They actually looked into it. Okay, that's okay. Yeah, it's expensive for me too. So I get it. Great Wolf can't pay for GLP-1 drugs for 14,000 employees.
Yeah. Maria?
Yeah, I was just going to say we have a couple of questions
Mhm.
here in the chat. So the first one from Valerie, she says, how does one balance that with the need to develop grit and resilience?
Yes. Um, can we do some Romie real talk here?
Yeah.
The number one thing you could do for your employees is not use the phrase, we need to develop resilience. And thank you for that vulnerability to ask that. You and I know as leaders, we want to develop resilience. That is a part of leadership and professional development. However, using that term in the field will break trust and integrity. Because what are everyone pushing back? Don't give me another resilience training or tell me I need to have more grit. I'm doing the job of 3 people right now, but I'm shutting up because I know if I get fired, there's going to be 7,000 applications with your AI system, and I may not find a job for 18 months.
Yeah.
So I think if I can have Dr. Romie real talk, I would say, yes, we need to give people the tools, but we found and clinical Data through the American Psychological Association and their Flourish method has found the same, is that when we actually train our, starting with your lowest level manager, so for us, it's a supervisor, then a manager, then director levels is how our organizational chart is, all the way up to corporate leaders. We chose, instead of grit and resilience, to train on empathy and trust. And that is a skill that builds into resilience, right? And by them modeling that, it was showing resilience and grit to the frontline employees. So I would say empathy and resilience is, and rewarding the grit and the resilience, number two, when we see it in the field. So not just saying, hey, great job, you exceeded your Q3, Q4 sales goals, but saying, wow, great job. I saw you had 200 people check into this hotel with a group, and you and the front desk team were smiling the entire time. I know you all must be tired. I just want to say, I see what you're doing. That acknowledgement. Does that help to answer? And Maria, you've been embedded in other organizations that have developed these programs, and you and I both have seen grit and resilience can become a hot button topic. I don't know what your suggestions and other sponsors that you've worked, plans you've worked with before did.
No, I agree with you 100% from my own experience. It all comes down to that trust and that empathy.
Mhm.
Um, if they don't trust you and they don't see the empathy you're bringing, there's no way you can go out and tell somebody, hey, you got to be more resilient.
Mhm.
Right. So
Yeah.
I think that's really where you
Yeah.
start, right? Um, there is one other question, but before we get there, I just wanted to also touch on something else, is that's the leadership buy-in, right? And you can make any benefit a great benefit. In my example, you know this. I'm passionate around mental health. And a previous employer, I put in a $10,000 mental health benefit. And what got the headlines in the media was the $10,000. It was the amount that our company was willing to invest at the time. But what really impacted the change was that leadership started talking about it, right? And I think that's the key around here, is getting that buy-in and building that trust and showing that empathy all the way from the top down.
Agreed. Maria, that's so well said. I've been successful in two organizations because I had the buy-in starting in with the CEO. When I came to Great Wolf, I learned about the brain science of trust because I had to ask an entirely brand new C-suite who had never had a chief wellness officer and all of our general managers to trust me. They didn't know what it meant to have a brain doctor or a chief wellness officer here. You have to buy in that trust and buy it in from the top. And the next thing I will say is a wellness program or any benefit you're bringing in will die in the benefits department unless it's executed operationally. So I always say, like, God bless everyone in HR and benefits. In today's world, in 2026, going into 2027, you all are dealing with more than HR folks did in 2019. It's just the scope of the job. And then all of a sudden, culture and wellness and leadership development become an arm in your business that you may or may not have time and resources for. What I always say is my role in wellness, or when I'm bringing ideas into companies, is HR provides the guardrails and the guidelines, but the executions happen with the operations team. So when I'm out in the field, it is our entire operations side, same with the previous company, that is actually executing BPAC positive, if that helps.
Absolutely.
Mhm.
We also had a request if you could repeat the three elements you use for discussing your ROI outcomes. And I think sticking with ROI, the other piece of this, I think we sometimes forget, is that sometimes we're not asking for a new investment. We got to find that money is usually already in the system, right? So
Mhm.
if you are looking to implement a new mental health, new well-being benefit, look at your disability spend, look at your productivity, right? That those funds are, you're already spending that money, right? So it's a reallocation of that capital, putting it back into programs that will have an impact versus letting them sit in programs where you're losing productivity?
Yeah, Maria, thank you so much for highlighting that wisdom. And what were the three ROI markers? So my three pillars are protect your brain, which is understanding what's in an individual brain score is and the collective brain score so we can see what that is. Then the second one is protect your people, and that's where the empathy, we measure that and the caring. And then the third, protect your business, is the trust index. And the trust starts internally with your employees, whether you're five or a company of 50,000. And that's how we're handling AI. And then you see the benefits. When I went in my first assessment and they had to go in and say, wow, look, this is what it meant to have a chief wellness officer. The ROI was the impact on a single employer leader and the cost to replace a higher level employer leader. You often forget that in your benefits. Your line item of mental health, using Maria's example, in a company may be, $500,000 to $1 million, but you can go directly and share the story of we saved the lives and jobs of three high-level leaders, and this is what it would have cost to replace them, and the business lost in that. So that employee retention piece has been the biggest ROI from the leadership level down to the front line. So it's ROI. And then most companies and organizations I work with, we actually see, to Chelsea and Maria's point, your stuff, like too much stuffing in the Thanksgiving turkey. For those of you that know that, I tend to put too many herbs and spices in there, and the learning from my aunties, I find that the benefit stack is overstuffed and we can save money in ROI. And the best thing is tailoring it to your company, corporate speak, your culture, your language. Power of pause and be positive is not something that would be translated into any of your companies because it's speaking our company language. And that's what it takes, is a branding strategy so that you're speaking the language of your people.
Thank you for that. Lindsay had a question. How does DEI fit in with your overall strategy?
I have to be very careful and cautious, and I'm taking a pause here now because of the public policies that are in place in North America. And we at Great Wolf, we are honored that our guests are from all over the world, and we serve a very diverse guest group, as are our employees. I think in today's world, with the legal policies that are in place that are affecting the workplaces, I would say it needs to be individualized. We look at it as engagement.
Casey is asking, would you say people who feel heard and trust their leadership will choose to be more resilient because they want to perform better and be seen as a great employee, like wanting to impress a great coach or mentor?
Wow, I love that. I think that's such great insight. I think it's twofold. You're absolutely right that if a supervisor manager, we know that the number one driver of your mental health is not your therapist, it's not your parent, it's not your spouse, it's actually your direct boss. Your direct supervisor or manager is an indicator of your health. So that's a lot of responsibility on supervisors, managers, directors, anybody that's a leader here. And we have to own that. And so yes, an employee will be more resilient when they feel like they trust you and that you care and there's empathy. And we have empathy and trust workshops that we come and do and train organizations to do, and happy to do that in partnership with Ethos to train. You actually train. This is not a personality trait that you're screening for in an interview. This is something you train your employees to do. So number one, there is this need of, I want to impress that mentor, but it's so much deeper than that. It's this, I belong here. I'm cared for. So I'm going to go above and beyond to do my job here. I'm not going to complain that I'm doing the work of two people, because they recognize that I am and they think that. So there's an inherent sense of purpose and meaning in the job because there's trust and empathy in place.
Would you say, Dr. Romie, that organizations that are like ethos-based, values-based, like really working for a greater mission and not necessarily just nonprofits, um, do you see that that ties to greater either engagement with wellness initiatives because they already have that like innate kind of passion for what they're doing, or do you see that tied into the retention? I know I see it tied into retention, but I'm not sure
It
on the
is.
wellness
You
side.
know, what you're speaking to is culture, that mission and
Yeah.
values align in the culture, and wellness is a core pillar of
Right.
that, right? Part of that. So however, that's the thing. Every C-suite wants to think, oh, this is our mission and vision, and we live it, and it's on the website. And as a company grows and scales,
Right.
it can become difficult. So there has to be training points
Yeah.
that reflect back to that. Because
Hmm.
any company I've worked with has mission and values. They can just get lost as you get scaled. I have chapter one of my book is Delta Airlines, one of the largest global airlines in the world and consistently in the top 5 ranked best places to work. They are aligned with their mission and values from their CEO to their operations. And I feel it when I'm on their planes. I feel it when I'm working with their operations team. You can feel it. So you can be a big organization and still be aligned, and you can be a mid-sized organization like Great Wolf, or you can be a small to medium-sized business like Ethos and have that.
Mhm.
And that starts with the leadership.
Yeah.
Mhm.
Thank you.
So we don't have any more questions.
I think I'm
How
seeing
would you,
some comments coming
there were
in.
some comments.
Mhm.
Yep. I was going to ask you around why do you think the market hasn't sort of caught up on the wellness? Like, what's the barrier?
I think I'd love to be partnered with Ethos and reaching more companies. I mean, number one.
Yeah.
Number two is that we're dealing with a very old-fashioned model where exactly how Chelsea introduced this, wellness is one small benefit in a larger benefits packet and portfolio, and outside of health insurance may not even be thought about. And that until we understand that taking care of the whole person at work is a not the responsibility of the individual employee when they're not working, but it is the responsibility of the company, the leadership, and the culture. That's how, when you protect your brain, protect your people, and protect your business, you're going to survive AI and all the tremendous change that's happening. I think we need a culture shift in that. I didn't come here to talk about benefits. I mean, for all of you that are listening, you notice that Maria, Chelsea, and I have given example of benefits, but we haven't said you absolutely need this benefit in place.
As
No.
a vendor.
Mm-mm. Mm-mm.
No, 100%. So much of this is about like the status quo, right? The status quo of I'm always talking about it on the health insurance side with the BUCA carriers and limited access and plan sponsors basically having their hands tied behind their back and pushed into a corner every renewal, trying to figure it out. But the same is true on the wellness side and mental health specifically. Um, the enemy is usually the comfort zone of, well, this is just how we've always done it, right? And I think we can learn a lot from the younger generations in our workforces about vulnerability, about leadership, right? As frustrating as some of those conversations can be sometimes, and having to look in the mirror. But yeah, guys, put your questions in the chat. We've still got a
Yeah.
few minutes. I know Dr. Romie's going to hang out with us here, so.
Yeah, I absolutely. This is so true. Per Valerie, per Gallup, 70% of employee engagement is a result of your relationship with the person you directly report to. That's absolutely true. I think the other thing I would say is, and please, Chelsea and Maria, push back on me, but if we're only measuring claims data, you're missing the mark.
Especially in a high turnover industry.
Mhm, mhm,
That's really like
mhm.
hospitality all day long.
Yeah, healthcare even. I mean,
Mhm.
most industry where employees are not being we're no longer in the era of like my father, where you got a job at a company and you retired there, or maybe you shifted companies. We know to get ROI and any meaningful health or wellness thing, you need 36 months of data. Most people will not stay 36 months, including the C-suite in this time of rapid change. So
Okay.
yeah. Mhm.
That is one of the questions. How do we get older traditional generational leaders to tune into wellness without the perception of it being perky and trendy?
Yeah, I love that. Lindsay, take my busy brain test. It is for free on my website, on my LinkedIn and Instagram. We find that when I go into a company and at least one leader, to what Maria is, sitting in the audience, and they take it and they turn around and they see their own score and the score of everybody else, numbers don't lie. And then all of a sudden, someone is hearing the story of this is what's happening. And that's how the buy-in is, because we've been selling wellness all this time as an extra perk. Do we need it? Rather than saying, our leaders are asking for leadership and personal development. Here's the tool. And our frontline employees are asking for help with stress, help with work-life balance. They don't need another resilience training. They need to feel cared for. And this is how you do it. When you say, we're here to protect your brain, protect the people, and then protect the business, you'll get the attention.
Yeah, and I can share a personal story on that. A couple of years ago, Romie, you were presenting at a conference that I was at my former employer, and you had us all take the test, and I did, and I said, "What on earth is that number? What does it mean? Why is it so high?" And when you came over after your presentation, I said, "This is my number," and you pulled me out of the conference. We went out and sat in the lobby for a few hours and just chatted, and you made me feel you heard me. So thank you for that. So everybody on the call, do take that. It really is impactful for your
I
own
just said it and I'm a
feedback.
little scared, actually. Dr. Romie, I need you to take me into a hall and have a
I
conversation with
got
me
you.
because
Well, you know what? And
It
that's
was
actually,
well above 70s. I will
yes,
tell you that. I was
it
like,
is.
what is
Yes. So
that?
above 40 to 50, you're in change fatigue and busy brain, and above 50, we're looking at burnout, and 60 with symptoms. And it can happen. And Maria, you're very humble, because I also remember turning back around and getting great advice from you. I was thinking transitioning organizations and leaving a organization I loved and going to a brand new one, and having to build trust as a leader in a new organization, and how many of us have had to go to new jobs, and you've been there. And I think, if anything, that's what Ethos cultivates, is a community of leaders that we can make sure that we say this to each other: I'm here for you and I care for you.
Yep.
yeah. Well, it looks like we have hit our time. So I highly encourage any of the outstanding questions that haven't been answered, please reach out to Dr. Romie directly. Dr. Romie, where's the best place for our plan sponsors to get a hold of you?
We'll make sure that a link with this recording and the Busy Brain test goes out to you all. Please, if I can help, whether you have a team of 5 or 50,000, and make sure that your employees feel seen, heard, believed in, reach out to me, drromie.com. I'm Dr. Romie on LinkedIn. The Ethos team will connect us. Help me to help take care of you, and as well as your team. No one should ever feel alone at work again.
Thank you so much, Dr. Romie. Thank you to everybody who attended. Don't forget to get the continuing education activity codes. They will also go out in the follow-up email from Austin. Austin, thank you for organizing. Maria, thank you for being an amazing panelist. And Dr. Romie, it's always lovely to hang out with you
Thank
and
you.
talk wellness. So thank you.
Thank you all.
Thank you all. Bye-bye.
Thanks, guys.